So today we're going to discuss what is the difference between chronic kidney disease and kidney failure. For those who tune for the first time, I'm Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help patients with kidney problems who are at risk of kidney problems or their relatives to understand better their disease, to be better informed, so they can manage the disease better with their own doctor or with me if they choose me. So that they can minimize their worries and complications. If there's no comment yet. So what is the difference between chronic kidney disease and kidney failure? Both chronic kidney disease and renal failure are the spectrum of the same disease process that affects the kidney function and the well-being of the kidneys. That process goes through different stages, progressive stages of chronic kidney disease, where the last stage is referred by many people as total kidney failure, when the kidneys stop working. Although the preferred medical term for the last stage is end-stage kidney disease. For clarity, I will use the term of total kidney failure from now on in this video series. Chronic kidney disease is the consequence of the damage caused by many different disorders and diseases in the kidneys. These disorders, these diseases, result in the progressive damage to the kidneys, impairing all the functions of the kidneys. Remember, we mentioned all the functions in a lot of detail before. The kidneys cleaning the blood, controlling water, controlling electrolytes, and production of some hormones, etc. And all the consequences by having the kidney impaired. So when these diseases damage the kidneys, impair all those functions, yeah? And there are 5 stages of chronic kidney disease, from stage 1 to 5, where stage 1 is the least advanced, and stage 5 the most advanced, and which can lead to total kidney failure when the kidneys completely stop working. And this is typically irreversible. But that time, dialysis or kidney transplant is necessary. Usually, although there is no an exact percentage of kidney function, when the kidney function drops below 5 to 10%, the patients can become very ill. And the situation can be life-threatening. And then, if dialysis or kidney transplant are not, put in place, life can be compromised. And dialysis and kidney transplant aim to replace the kidney function loss. They don't cure the disease. They just simply are doing partially what the kidneys normally do. So, and as I mentioned, sadly, if a patient doesn't undergo dialysis, can lose his or her life. So that's why it's important to detect kidney problems and manage them as soon as you have them, manage them well with medications, lifestyle modifications, diet, etc. In Francisco Kidney Medical Center, we understand how confusing this can be, so we give detailed explanation to our patients with the aim of answering the queries and dissipate the concerns. Not to create more concerns, but it is actually simpler to face the disease and understand them better, understand that indeed things can go wrong, rather than those wrong things catch you by surprise, unguarded, and then the consequence of those complications is even more dramatic. So it is better to be aware of them and manage them well, rather than just don't know about them and one day everything can become very dramatic, needing going to A&E, or sometimes unfortunately many patients don't make it because let the disease continue without preparing or planning for replacement of the kidney function through dialysis or kidney transplant. So